Hi everyone, today is the 3rd of July 2026. I am here at King George Hospital for my urology appointment. As you know, I've had a blood test done on the 24th of June 2026 with my GP, and I have still not received the test results for that till now. As you know, they have continuously covered up my true conditions and what I've been suffering with and the things I've endured. As you know, King George Hospital was complicit in covering up my NHS system compromise of ultrasounds, MRI, and the previous MRI I've ever had here. And they have booked me in for a urology appointment. So let's go in and see what they say. And yeah.
Did you 99?
Yeah.
Yeah?
With a flight, without a flight.
Do you have to give a look? See a passport?
Harry Junior.
He used to keep going upstairs, going downstairs, going that side, this side, he always questioned me.
Let's run out. Hello.
Okay, I've got an appointment today.
Yeah, they'll do that for you, yes. We'll get an email from the admissions to book you another appointment and another
What
one
time
will
is
be
the
done
appointment?
for you.
2:30.
That's correct, yes, that's what happens, and then someone will call you or
And
you
your
get a
name?
letter or a
Shajul
text
Rahman.
to come in. No, I don't know how it works. It wouldn't work just as
Can
quick
you
as
spell your
that.
surname?
It would be.
REHMN.
I can take some details, but I can't promise you that will be the case. What's your hospital number?
How did that pen get there? Huh?
How did that pen get there?
Pardon?
You've got to watch him. He loves to lick a pen.
She put it
He
there.
loves it was you. He loves to
Red
lick a
ham.
pen.
Is it R-E-H-A-M?
MEAN.
Shagio.
That's it.
Look, I mean, he's got pink. That's pink as well.
Right, and what's your name?
Where you got pink pen for?
What's your name for me?
They're not right.
You're fibbing.
She put it there.
S-U-M-H-A-R-Y.
And Ilford Medical Centre. And the mobile ND537.
Correct.
And who would be your next of kin? Who would you want to nominate as the next of kin?
I'm still alive.
Yeah, right. It's only for emergency.
My mom.
Right, okay.
Someone to contact. You never know what happens in life, you know? She's also rehab.
Thank you. You're welcome. Bye. Bye.
Thank you.
Hi sir,
How are you doing?
how are you?
I'm good, thank you.
Let's see. So confirm your date of birth with me.
17/01/99.
And I'm Mr. Reader, one of the consultants. Tell me about your problem.
So I've been having a lot of internal organ pains, especially my liver and both my kidneys. Right? I've got.
Since when?
It's been going on for a very long time, where I have done everything to expose the medical fabrication, the alteration of blood tests and everything, right? And they just have kept me in this vicious loophole, vicious cycle.
Who has?
The whole NHS is, I've gone to the GPs, I've done blood tests, right? I've done the blood test on 24th of June with my new GP, right? And I still have not received the results. I've given them my urine sample, which I've had to go to St. Thomas Hospital up in Westminster, where, you know, the only...
With the same problem?
Yeah, obviously with the medical fabrication, what's been happening to me.
Medical fabrication.
Well, I say medical fabrication, that means the NHS systems are being compromised to cover up my true conditions. They can alter blood test results. They have hacked into the MRI ultrasounds that I've done here, right? I've reported this to PALS, I've done everything, but what they have done is they're playing psychological
Why would
evil
we
games.
do that with you?
Because I've become their target, and they've been covering up my true conditions. So now what they have done to me internally, my organs, all the symptoms for my liver especially is at stage 4, where how my bones, my body has been breaking down, and I've been left to endure it, right? Making sure that I stay in an environment that is just keeps me trapped. What I want to know from you guys today is, where is my blood test results, right? Why have I still not received them, right? Now they have finally...
That was done by your GP, right?
That was with the GP. They have finally acknowledged the blood and urine, right? Before they were denying everything. And because of the dipstick, it has come clear. right? They done that at St. Thomas back in November 2025, right? And they found blood in urine. And since then, even till now, same thing. And
Have you ever seen the blood?
the blood test,
No, you said you've had blood in the urine. Have you ever seen blood yourself?
yeah, when I done it with the GP,
No. You've peed blood. You've seen blood in your
Yes.
wee. Have you seen it?
yes, I've reported it. I showed it a long time ago, and
So tell me when the first time you saw it was.
it was months ago. It was before November.
Okay, and going back to November, the first time you had it, was there any pain associated with the...
So I used to have penile pain, which I still got here and there, right? Before it was much worse, but somehow they have managed to do something. But my main concerns is my internal organs, how they have targeted my liver and my kidneys, where I have to hold and suppress the pain throughout the day, right? When I'm walking, I can't walk properly. I get pains in my legs, and yeah, just slow movement. And when I've done the MRIs, your NHS systems have been compromised, which I provided evidence of, right? To PALS, to Health Ombudsman, and what they have done instead is
You've been to PALS here?
I've emailed them, right, directly,
Right.
and what they have done is they have kept me in a vicious cycle, so they can avoid accountability, right? And how they have tortured me, and just kept me in an environment that just go here, go there, do this, do that, done everything from my end, and I've kept up with them, with their lies and everything. Whereas,
Okay, can I stop you there?
Go ahead.
This is way
because
too...
I'm trying to bring you in the
No,
loophole,
I know, but
and
this is way too deep for me.
it is.
All I want to know today is, I don't want to know about any compromise or changing of results. All I want to know from you today is what's going on with you medically. So that
I keep having to repeat myself. Where is PALS, right? You got PALS office
But
here.
today's the first time you've seen me.
They all say that. How many times have I come to...
I've never seen you before.
Okay, you haven't, but I'm saying other GPs have, right? They're playing that same
Ignore the
psychological game.
GPs.
Not just GPs. I've come here, Urology department, right? I've been to a Urology department in Newham as well, right?
You've never been here, urology.
I've been to the Newham one.
Yeah, but not here. We're different.
King George. Okay, but that's the trick, isn't it? All your systems are different. King George Hospital systems are different. They have wiped out my NHS medical records from my app, where now, because I've changed my GP, I have to have a fresh start. But where does it leave me, right? Now you have acknowledged the blood in urine, right? Where are my blood tests? Where's my urine test that was given in? I've still not received the results, because I've kept up and they've...
But that's a GP issue, sir.
It's not a GP issue.
It is.
Those tests are coming to this hospital.
It is, but whoever orders the tests, which is your GP, they have a responsibility to give you that.
Okay, it's been more than 7 days. I've still not received
So
it.
if you have a problem with your GP, take it up with them.
I've already notified them, but what I'm here for is an MRI of the abdomen pelvis,
You've already had that.
yeah, which was compromised, right?
No.
Which I've shared details, and how NHS systems have been compromised to cover up my true conditions.
Okay.
And you keep saying the same thing. You deny me my every right. You don't take action on the evidence I provided with what's been. So
Do you want to reset? Because at the moment, I'm here to help you instead of being accused of doing stuff.
I'm not accusing you,
You
but
have.
I'm not you as a
Right.
GP, right? But what I'm saying, this evil system, right, where it has trapped the victim, who has exposed the medical fabrication very well, where this specific hospital, right, the blood tests have come here many times. Someone's been ordering, playing with
Can we
the
just
numbers.
move on from this?
You can't move on because it's my
can.
life, right? I'm
No,
not
I can
here
move
to play
on
games.
To the problem that you've come to see me about. I can.
I've told my GP that there's no need, because I'll get trapped in the same vicious cycle again.
So you don't want me to investigate you?
I do want you to investigate, right? I want you to do whatever you can, but what I'm here for is an MRI of the abdomen pelvis, knowing there's blood in urine, my organs are affected, right? I've got symptoms of stage 4 liver, right? And how my kidneys both, like, you don't know the pain I've lived with,
Listen,
enjoyed.
I'm not disputing your pain. I've not said anything.
You
about
do
it.
what you have to do.
Okay, you're not getting an MRI because you don't want.
That's what you say. That back in November, they said the same thing. Right? One of the radiologists.
Do you want to let me finish?
Go ahead.
You need a CT.
Whatever you can do.
Okay, I'm gonna keep this short and sweet because otherwise we can be here forever. So you need a camera into your bladder.
No, I do not want them going into my body until they provide me with scans that are real.
So
that are not
if
fabricated.
you're here to be helped, you can't dictate what you can and can't have done.
Like, you have said that they gave me this option on the phone, and I've told them that I do not want it because what I'm planning to do is I'm going to Istanbul, right, for medical tourism, where I'm going to be having all my. I've selected this hospital. I've been in contact with Live Hospital in Istanbul, Koç University Hospital, and
Right.
Medical. And I've seen their different packages, what they offer, and I want my scans, blood tests to be done there as well. But I also want the GP here to do it before I leave the country.
Why are you having scan after scan after scan after scan? What's the justification of that?
You have no clue what I've gone through, right?
Again, I haven't
Mhm.
disputed that. But what is the justification for repeating scan after scan after scan?
It's not me repeating scan after scan, right? I've lived with some very terrible conditions, right? Pain 24/7 all over my body. You don't know how my bones break down throughout the day, even when I'm sitting, laying down, right? And what I've suffered with is I've had to keep up with them. Where I go to a new GP, I go to a new specialist, right? I have to explain everything, even though I've provided PALS, the health ombudsman, thorough evidence of how the medical fabrication, how hackers have been manipulating MRI systems. They can compromise and make your imaging appear on however they want. And that's the trick. I can show you a video where there's one news channel that exposed it back in when just before COVID. And I want to share this with you as a specialist, and so you are clued up on. It's only a 2-minute video, but it will help you understand what I'm talking about. And it has happened to me in this specific hospital, where the blood tests are coming here, the MRI I've had done here after November, after they found blood in urine, which they delayed till February, right?
Yes.
In November till Feb, and it's all clear now. And I don't want to sit here coming round and round because I want to.
I'll ask you a
change my life.
question. So I'll do this test, and I'll give you the results. Are you going to turn around to me and say this is now fabricated?
Not you. Obviously, it depends. It is the NHS job, right, to prevent anyone manipulating these systems, and they should know very well how throughout COVID.
But what's the reason for manipulating it? We have no reason to.
They do target certain individuals,
All right.
and you won't understand it, right? Because of how well I've exposed it, I've documented everything in and out,
Right.
so they know they can't play with me anymore because I document everything, right? I have record, I've proof, evidence, I provided all that.
That's fine, sir. Okay. So, is there any need? So you don't want a camera test?
Yes.
You don't?
Not yet. No.
You don't want one yet?
Until
But you're
they come
happy
out.
to have a CT scan?
Correct.
And whatever the result comes back as, you're going to accept that result?
I'm not going to accept it if it's fabricated and they're not as revealing my true conditions.
So
That's because it's NHS job to prevent any system
but how
compromise.
will you know the results I've given you has been fabricated or not?
If they come back just them putting a simple kidney cyst in my kidney, even though my things and even though my condition internally is much worse, then you know it's fabricated.
No, because a scan cannot always tell you what's going on inside. You can't rely 100% on the scan.
That's why we'll compare it to the ones I've done in this
So
country
you've had one
before I leave.
You've had one private scan, MRI scan, and then you've had one in the NHS, and both have reported this small cyst on your right kidney.
So with the radiologist, right? With the radiologist that I had done privately,
Yeah.
he spotted lymphs in my leg. On
So
it.
you got the report?
This is the thing. He told me this personally because I told him how I've been targeted,
Right.
right? And I have video evidence of it, and he's told me He said, I found lymphs on your legs, and they did not add that on the report. It's the same
Okay.
part of the big conspiracy. It was connected to Harley Street and stuff like that,
Okay.
where they did not agree to it on paper. But because it was the radiologist who done my scan, I told him about what I've been suffering with, and he done, you know, he tricked the hackers who were manipulating it while I was doing the MRI.
What about the second scan?
And since then, they have kept up with the same story where they just added mild fatty liver, they added simple kidney cyst, but
Okay.
things have been much worse. And I'm not going to sit here, exaggerate or do anything. I've
So
told you the
unless the
reality.
scan says something significant, you're not going to believe it.
Let's get it done and see where it goes. If it is the NHS job, with everything I've provided them, I've also provided them documented evidence on how to prevent CT, right? How to prevent any compromise of the CT, and they know how it works.
Do you know how CT's any scan works? Do you know how the process works?
But I kind of know the process.
Right.
What I'm talking about is much deeper.
I'm going to tell you anyway.
Mhm.
When someone has a scan, the radiologist looks at the scan and he makes a detailed report. That's his job. On top of that, when I get, or any of my colleagues get a scan to look at, we look at both the reports and whether it correlates with the scan. Yeah? So if the scan comes back normal and it's been reported as normal, and on top of that, we, non-radiologists, look at it as well and can't see anything, isn't that enough to say the radiologist is correct?
So with what I've battled with, right? The radiologists and everyone has been tricked, right? They
Right.
can make your scans appear however they want. Right? So have you got access to Google on your PC?
So, well,
you
Go on, just tell me.
watch this 1 minute 30-second video, and you will see for yourself, because you're not understanding me clearly. Watch this,
No.
and it's evidence.
I'll be honest, it's
Mhm.
the first time I've come across a patient
It's
like
true.
yourself.
Who has stayed alive long enough to expose this?
Okay, you're one patient of how many tens of thousands that I've seen, and you're the only one who's ever come up with this conspiracy theory.
It's not a conspiracy. It's a reality, right? Why don't King
If
George?
it's reality, there will be more.
You can take my blood test today, and you see the
Okay.
things I'm suffering with. This is why they have. But I'll leave you to it, because now.
No, I know. Let's get the scan,
Mhm.
and then we'll talk again. I think that's fair, isn't it?
Yeah, we leave it there.
Yeah, is that
As,
okay?
as long as NHS does a scan before I go to Istanbul to get my.
Can you? But then it goes back to, if you're going to have all these scans in Istanbul, why are we doing a scan there?
Is to show you what they have done here, right? This is the condition I've
You've
left
already
with.
had 2 scans done now.
Listen, let NHS do it, but you have found the blood in you. Let's follow the process, even though they're flawed.
It's not flawed.
They are very flawed, and you will see how they trap victims of medical. You don't know how many people have.
Do you see anyone about your beliefs?
This is what I'm saying. It's not a belief. You will not understand it until you are exposed to this reality, right? You have not had any patients that have suffered with this, right? Maybe they have been a target of medical fabrication, but they're no longer alive.
I can see you had the same kind of discussion around what we're having today back in Newham.
I've explained this to them, and
and what they've recommended is some psychological counselling.
they can do that all they want, and this is what I'm saying. It's the vicious cycle, isn't it?
Yeah.
Let's do the CT of the abdomen pelvis,
Okay.
and where will it be done?
Just remind me when you're going to Istanbul.
So, fingers crossed on the 12th of July.
Next week.
Yep.
We're not going to go to scan before then.
I mean, that's your call. Obviously,
It's not my call.
I mean, they can do it, because I've requested for urgent MRI.
Private.
No, for here, right? They booked me in for a 9 p.m. appointment the same day. So if you can push for it, that's up to you guys. My blood test results,
Do you want
if
to?
they're done accurately, they are enough.
If I tell you they're normal, are you going to believe me?
No, because I know what I've suffered with. Like, what I've endured.
Nice to meet you. You take care, alright? We'll see you soon. When are you back from Istanbul?
I'm not too sure yet, so I'm going there once I get the scans and everything done, and I'll see where it goes from there.
Okay.
It will be, fingers crossed,
Alright, so
next
you,
week. Yeah.
you take care, alright? I'll see
So
you.
when will you be booking the?
So I'm going to request it and leave it to the Radiology Department to contact you to book it.
And that will be for the abdomen and pelvis.
It covers everything from chest to pelvis.
Perfect. And
So, okay.
yeah, if you can mark it as urgent.
It's already urgent because you've been sent
Perfect.
on a path.
Because I've been to St. Thomas, you know, the only thing for them to get away, you know, avoid accountability, the only thing they have done is a urine sample test
Who?
with St. Thomas Hospital up
Okay.
in Westminster. So
Okay.
even though they should have done blood tests
Mm.
and then we see where it goes from there, but they avoid that.
No problem. Okay, so, alright, nice
That's
to
fine.
meet you.
I'll leave
Take
it.
care, alright?
Perfect.
Alright, so see you.
Thank you.
No worries.
Do I get the referral form from?
No, you leave it with me.
Leave.
Yeah.
Perfect.
Alright, take care.
Medication review. So you're taking lansoprazole 15 milligrams every day at the moment.
Correct. Yeah.
Yep, that's fine. So prescription was sent to your pharmacy on the 22nd. So have you had a gastroscopy before, a scan of your stomach?
No. So I wanted to book an appointment. Right. It's quite urgent. I've got severe issues that I've been battling from. You know, multi-organ failure. I've been to. This is the reason I've had to change my GP. I obviously I've been trying to get hold, and you know, for some reason your queue is like 30 people, and then by the time I get called back, I get busy doing something. So yeah, I've been battling with some very severe issues, and now what the NHS app has done, and then someone in the background has deleted all the records of my consultations, everything, as soon as I switch my GP. So why have they done that, right? Now me explaining everything to you, you won't know, right? They found blood in urine, when I went to St Thomas Hospital up in Westminster in November. They keep telling me there's a kidney cyst, but it's much more severe than that. My liver has, it has reached stage 4 now, right? My bones, everything, and I've done everything I possibly can to keep up with it. So I need your help booking an appointment and getting a MRI done, and a blood test from your end.
Okay, I think you've had MRIs in the past. So I'm just calling in regard for your medication review. I'm one of the pharmacists here. What did you want to discuss? You said you want to discuss your severe autoimmune issues.
Not autoimmune. So what it is basically multi-organ failure, and they keep lying about there's a fatty liver, there's a kidney cyst. I need to, I've made a report about the medical fabrication where the NHS systems are being hacked into to cover up my true conditions, and I need to book an appointment with a GP to come in, get a blood test done from your end with your GP, blood test and an MRI booked in ASAP, because when I went to St Thomas Hospital, they agreed there is blood in urine.
Okay, and with your stomach issue, so you're taking lansoprazole every day, is that helping with the acid reflux?
Yes, I've been forced to do that, and this is why it's needed. Like I said, it just kept me on medication until they can delay and control the situation. Blah blah blah. But for now, all I need from you is get a booking and come to your GP ASAP, and I can give you a date. If you can book me in for that. And
So that's fine. We'll just come to that in a bit. So you're taking lansoprazole 15 milligrams every day. It's helping with your acid reflux. Do you have any unexplained weight loss or blood in your stools?
not in the stools that I've noticed, but I've been suffering from penile pain, and I had a few times where blood in urine, which was spotted by at the GP at St Thomas Hospital. She agreed to it, done the checks, done everything, and they didn't let me get any further testing done there. Right, so I made a complaint. So they have kept me in a vicious cycle of going back and forth with everywhere until I go insane, until I'm unable to expose what I have uncovered about the medical fabrication and how they compromise the NHS systems, alter the blood test results and everything.
So if you want an appointment with a GP, unfortunately, we're not allowed to make appointments with the GP. What you can do is do an e-consult, saying exactly all you said, saying you want an appointment with a GP. I'll just send you a link, and then you can fill that out.
Yeah, sure. If you can do that, I need to book one ASAP. I've been trying to get hold of your team, but no one seems to pick up. And whenever I tried to order medication, for some reason it was getting cancelled from your end because I ran out of lansoprazole and I needed it.
Yeah, so the lansoprazole, that's been sent to the pharmacy, so you can collect it if you haven't already, and then I'll just send you the link to make the GP appointment. And you're not taking any other medicines?
No, like I said, I shouldn't even have to take lansoprazole, but they've left me with severe condition and just force you to. But yeah.
Fine, yes, I'll send you the link and then you can do that. All right then, thanks for your time.
Thank you, sir.
Bye.
Good afternoon, Ilford Medical Centre.
Good afternoon. I've been trying to get hold of you guys for a very long time. I've just registered to your GP. I'm trying to get an appointment to see a GP.
Okay. Can you speak up a bit? Your line's really bad. It's coming and going.
Hi,
What is your date of birth?
can you hear me now?
What's your date of birth?
17
Uh-huh.
01 99
Uh-huh. 19.
9.
And your name?
Shajul Rahman.
And what is the problem?
So I've been to St Thomas Hospital recently, and they've I don't know if you can you see on my medical records? Is there
You've been to the
anything there?
hospital?
St
Was
Thomas
it an A&E?
A&E, yes. And obviously they've told me to go back to my GP, and the only test they were able to do was a urine sample test,
Mm-hmm.
and they have agreed that they have found blood in urine,
Right.
and told me to go back to the GP. They have left a note. They have left
So is there still blood in the urine?
Yes, and I've been living with some severe conditions, but I've been left like this, until
Hold on. So you're getting blood in the urine,
which they have also spotted with a dipstick.
and so are you passing urine okay?
Yes, obviously I've explained my penile pain and the rest, but my symptoms are much more severe, which
Hold on. So passing urine
Mhm.
okay. And what were the symptoms you said?
I'm calling to speak to book an appointment so I can get an MRI and a blood test done ASAP.
Okay, so that you speak to the doctor after, but I need to know this. So you're getting blood in the urine, you're passing urine, okay? Are you taking anything for the for the urine, for the
No,
blood in the urine?
I've got pain in my liver. I've got pain in my
You
kidneys. Right.
say pain in stomach. And how long have you been like this?
It's been many months. I've this is why I've had to change my GP because no one is doing anything, and
Okay,
they've
so
kept me in this
when would you
vicious
say it
cycle.
got worse?
They have just left me like this, until they can break the person down. And
Okay, so you've had it on
I've been
and
everywhere.
okay, so you've been on and off for how many months has it been? You've got the
No,
symptoms now.
it's not on and off. These have been continuous symptoms I've been living with. I've endured this pain very long enough, and I've done everything.
Okay, so and you need to give me a time. When you say very long time, what 1 month, 2 months?
No, no, it's been months. Like I said, I've been battling with the NHS. I've reported this to PALS, Health Ombudsman, and no one has done anything.
Okay,
Where
so you're not so even when
my
you went to
medical records
A&E.
I have been altered. They've been
Yeah.
fabricated, which I've provided evidence of and everything. And I've had
So when you
to.
went to A&E, did they
Mhm.
give you anything for it?
They have left a document on my medical records because as soon as I've joined your GP, all my medical records have been deleted from the app. I can no longer see my previous medical records, right?
Oh,
So I need all of them to come back. That's another thing.
okay. So that's
And
okay. Let's deal with this one first. And for the medical record, you can put in for an e-consult, and then
and
we'll pass it on to that correct
that's it.
department.
And so when it comes to obviously when I went there at St Thomas, the only test that they done was a urine sample test, and he said there's blood and urine
Okay,
found,
just
and
bear with me.
the
Bear with me. Let me just
Mhm.
speak to the doctor. Hold on. Hello.
Hi there.
Hi, yeah. So you're gonna have to actually put in for an e-consult. If you want it for tomorrow, put in for an e-consult now, and then put all the problem that you've just said, and then you get a reply within 24 hours.
So what time can you give me the appointment today?
So today I was gonna give you an appointment for, hold on, 2:45.
No, I won't be in. Can you not
You
do that
won't?
for tomorrow because
I can't do it for tomorrow. So all our appointments are on the same day. So if you want it for tomorrow, just put in for an e-consult now.
on which app? The NHS app.
Sorry?
Which app?
I will send you the link now.
And I can get one tomorrow.
Yeah, so just put that down that you want an appointment, face-to-face appointment.
And I will get it same day.
Yeah.
Okay, can
If you
you?
put it in
Because I
today,
was waiting for you guys to call me back because I was told the GP would take care of the
so
rest.
how it works is we don't actually pre-book any appointments. If you want an appointment for tomorrow, put in for the econ so you get a reply within 24 hours and just put the times that you're available.
Okay, so if you
All right.
can, I'll do the e-consult if you can book me in for tomorrow. And
So you need to
also
put in for the e-consult first.
the conversation that we have had, can you put it on the
Yes,
consultation
yes,
notes
so
so
just
we can keep a record
put
of
that
it?
down. You don't need to put, yeah, just put down the symptoms that you've said, that you're getting blood in the urine, and then you're getting the stomach pain, you would like to see a GP, and then just put the
Abdomen
times that you're
in
available, and
organs.
then send it in to us.
Got it. I'll do that. Can you
All
send me
right,
the
okay,
link?
thank you. I'll send you the link, yeah.
And who am I speaking to?
Sorry?
Who am I speaking to?
So you're speaking to Naz.
No. Got it.
All
Perfect.
right, thank you, bye-bye.
Cheers, bye. Hi there.
Hello.
Hi, can you hear me?
Yeah, hi, good morning. This is Zaf from Ilford Medical Centre. Can I take your date of birth, please?
Morning. Who am I speaking to?
This is Zaf from Ilford Medical Centre.
Hi there. Yeah, it's Sharjil.
What's the date of birth, please?
1701
1701.
99.
And you said Shajil. Sorry, what was the name?
Sharjil Rahman.
Shajil Rahman. Yeah, how can I help?
Hi there. I was supposed to get a same day appointment. I was
Oh,
offered
okay.
that
Just hold on
yesterday.
for me one moment, please. Hello?
Yep.
Yeah, I've arranged a telephone appointment with one of our doctors today. You should receive a call within the next couple hours, okay? It'll be before 1 o'clock today.
Is it was it not for me to come and see the GP?
Yeah, so the initial assessment will be over the telephone. If the doctor still feels like you need to come in, they'll be able to arrange that face-to-face appointment on the same day.
Okay, because I called in yesterday. So did you receive my request from the NHS app?
Yeah, we received your request from the app, yeah.
And the only best thing you can do is a telephone appointment today.
Yes.
That's fine. What time will it be?
It should be within the next couple hours. It'll be before 1 o'clock today.
Before 1 hour? Yeah, that'll be great.
Alright, thank you. Bye.
Okay. And wait, they can do
Yep.
referrals and blood tests over the phone, right?
Yeah, they can do everything.
Perfect. Thank you.
Alright, thank you. Bye.
Cheers, bye. Hi, can you hear me?
Hi, could I speak to Mr. Sharjil Rahman?
Yeah, speaking.
It's Dr. Asma from Ilford Medical Centre.
Hi there, how you doing? You okay?
I'm good, thank you. How can I help?
Just give me 1 minute. Hi there. I'm calling to get a blood test done and an urgent MRI of the abdomen and pelvis done.
Mm-hmm.
And I was told by St. Thomas Hospital when I went there that they're not going to do any tests there. They've done a urine sample test and they found the blood in urine and everything, which they have left the documentation, the report on my file, which I've been told you already have. Right, I was waiting for you guys to give me a call back, but to book an appointment and stuff to proceed with the next steps, but nothing was done. So I've been continuously chasing this up, and there's already been a lot of delays where the first they found blood and urine in November 2025, and since then it's been ongoing where I've suffered a lot, right, and I've been kept in this vicious cycle of NHS going back and forth, making multiple complaints to Powers, Health Ombudsman, and everyone. And I've told them the things I've been suffering with and everything that's been done to me, and I've been living with very severe conditions, and they have done nothing
Okay.
to.
So when you went to St. Thomas's hospital, did they check your urine this time?
That's the only thing they've done. So I went to A&E, I told them my symptoms and everything, and they already
And
know
what was
about
the urine
things
findings?
So they done a dipstick and they found blood in urine and told me
This time as well?
yes, and
Okay.
they
Okay.
told
If you
me
come to the clinic, sir, are you able to get here today? If
what
I want
now?
to see you and check your urine? Yeah.
Yeah, sure. But again, what I'm looking for is an urgent blood test and an MRI referral.
Yep. If you come to the clinic, we can have a chat. It's 12:45. Okay.
So do you want me to come at 12:45 now? Yeah.
Yes, please. Yeah.
And you'll be able to give me both of those.
I will need to examine you, check
Yeah,
your
sure.
urine, and then we can
Not an
make a
issue.
plan.
Um, yeah, like I said, the only thing that they've done is dipstick. Have you got the report on your documentation?
I've got an A&E letter. Yeah, we can go through it together. If you come over, we'll see you together. Okay?
Sure. So do you want me to be there at 12:45? Yeah.
Yes, please. Yeah.
Perfect. I'll pop there now.
Okay. Thank you.
Yeah, I can hear you.
Yeah, I've got a call from your phone saying
Yeah.
to call back this number for an appointment.
What's your name, please?
That's Shajul Rahman.
Yeah, perfect. So you've been referred by your GP, sir, regarding coming to see a urologist.
Correct.
So I can see you had your blood test on Wednesday.
Yeah, have you sent me the results to the GP because I can't see it online yet.
No, so you'd have to contact your GP regarding the results.
Okay, so I can't see it on the NHS app.
You should be able to. I don't know why you can't.
I haven't. Yeah, I haven't. I can't see it.
Perhaps trace up your GP because I can see you've had them here, so they should be readily available for you in the app.
Okay, I'll have a look. Again.
But we're going to arrange for you to have the flexible cystoscopy.
What's that?
Which is a camera into the bladder.
No, I don't feel comfortable doing that. I was told it's a urology appointment where they'll book me in for an MRI of the abdomen and pelvis as an urgent referral, knowing what I've been going through.
We can't arrange the MRI scan without you being under the care of a doctor first.
Yeah, but I don't want
you don't
them
want the camera.
to. Yeah, I don't want them going inside my body or doing any other harm because of what's been done to me already.
So I can book you to a consultation first.
But I was told this urology department will book me in for the MRI of the abdomen and pelvis urgently.
So I can't book you the MRI scan. It has to go through a consultant first, and because you haven't yet seen a consultant yet, that'll be later on.
They continuously kept me in this vicious cycle, in this loophole of going here, going there. But as fast as you can, I've been living with very severe conditions, and they've found every excuse to delay this until they can get away with it. So what's the fastest available? Because
So I can book you next Friday the 3rd at King George's in the afternoon.
Yeah, I've explained to the King George team already. Everything I've been through, the medical fabrication, what I've exposed. I've given them evidence. I've reported this to PALS, Health Ombudsman. But what they've done is kept me in a vicious cycle until they can break the person, and yeah, they're just putting me through so much stress, and you don't know the pain I've had to endure and continue going because they play all sorts of psychological tricks on the victim, and that's what I'm saying. Now I've told the GP we had the blood test, right? I still can't see the results, but I'll try again later. But for the urology department, I was told they'll be able to book me in for the scanning that's required, which needs to be done urgently so we can get to the bottom of it, and they have to prevent any hackers on hacking the NHS systems for NHS systems to be compromised, so they can cover up my true conditions. So how can we achieve that?
So I'm going to book you a clinic appointment first.
And how fast can this be? Because I'm planning to go into another country for medical tourism, right? Because of what the NHS and the private health networks have done, and so I want them to do an MRI here of the abdomen pelvis before I leave.
So I can book you next Friday.
Because last time they took a month and they gave me fake fabricated results.
So you are on a 2-way pathway. So I can get you in next Friday, the 3rd of July.
Okay.
It's 2:15, okay?
3rd of July, 2:15, yeah.
That'd be at King George Hospital.
That's fine, yeah.
In the outpatient space 3.
Mhm.
And I'm going to send you a text which will confirm those details for you.
And you have nothing earlier than that?
No, that's next available. We did have earlier for the Flexi, which is the camera, but I completely understand your reasonings why you don't want that. So
yeah, no, I don't want them
available.
to do anything worse.
That's understandable.
So this is a GP appointment where they'll be able to refer me for an urgent MRI. Is that correct?
That's correct. This is just a consultation with the urologist. Nothing invasive.
Can I select a different hospital? Because I don't feel comfortable with King George. I've had my blood test done there, blood test sent there, my MRIs, ultrasounds, and there's a lot of manipulation of the medical records going from that hospital.
I can book you to Queen's.
Yeah, let's do Queen's.
But we are the same trust, so I can book you to Monday the 6th at Queen's.
Oh, it's going to be delays.
Yeah, it'll be the 6th at Queen's.
Okay, the earliest is fine. The 3rd will do.
Okay. I'll send that by post by to you, and I'll send you a text as well.
Perfect. Thank you very much. And
You're welcome,
your name,
sir.
please?
Hannah.
Hannah. Thank you, Hannah.
You're welcome. Take care.
Cheers. Bye.
Bye.
Sorry, CT scan
A
at Barking
CT
Hospital.
scan. Yeah, I'm calling from Barking Hospital.
Yeah,
Right, are you available to come in on the 18th of July?
18th of July. I cannot because I'll be traveling abroad.
When are you travelling?
On the 12th.
Oh, you're going on the 12th. And when are you back?
I won't be back till the 20th.
Right, can you do the 21st?
21st. No. Have you got anything on the 23rd?
23rd. Let me just have a look. Yeah, but it'll be at 5 p.m. Is that okay?
5 p.m. That would be great. Yeah.
Yeah? Right, you do need to fast 4 hours before the scan, but I will send you all that information in a text message now, okay?
So is this the CT scan for the abdomen and pelvis?
It's the CT scan for the urinary tract.
I was told it will be done for the abdomen and pelvis, not urinary tract.
I'm not too sure that's what your consultant has requested for you.
That's inaccurate because when I asked him, he said it will be done for the abdomen and pelvis, which is because as my main organs, which is the liver, the kidney, I've been...
Yeah, I know. It says kidney on here. That's probably why he's doing it.
Yeah, but if it's just the urinary tract, then it won't cover the full...
Well, on the notes, that's what he's written, renal tract.
Yeah, for the abdomen and pelvis. If you can confirm, it will be for the abdomen and pelvis because I confirmed with him.
We can only go by what he's requested.
Which is the abdomen and pelvis.
No, it's the CT urinary tract. That's what he's requested. But on the referral letter, it states renal tract for the renal hemorrhage cyst.
Because
So I think with that, they'll probably be able to see it.
Urinary. Because it's important, avoiding the whole area, which is the liver, the kidneys, and the prostate.
So for the kidneys, they usually do the urinary tract with contrast.
No, I do not want any contrast. I want it without contrast, and it has to be for the abdomen and pelvis. If you can confirm with them, because otherwise there's no point.
Right. So what did you want us to do? Because he's requested it with a contrast.
Because when
did
I
you
went
want us
there,
to cancel this?
He did say it would be done for the abdomen and pelvis, but you're saying something else.
Yeah, that's what he's requested.
Yeah, can you double?
Right, that's fine. So we'll send him an email and let him know, okay?
Yeah, for the abdomen pelvis, and then if it can be booked on the 23rd, and you can then...
I can't guarantee it will be on the 23rd because we still have to wait for the consultant to get back to us.
Okay, or any date after the 20th.
After the 20th, no problem.
So should I expect your call back, or should it...
It won't be today because I know, obviously I don't even know if he's working today, so it'll probably be sometime next week now.
I won't be in the country next week.
Oh yeah, you're not in the country, but what we can do, I'll leave a note that you're travelling from the 12th to the 20th. And if they do get you booked here, I'll just let them know to send you a text message. Is that okay?
Because they were supposed to get me booked this week, and they did not call back. They just sent me a letter, which again does not explain what we discussed.
I'm not too sure who's booked that appointment for what. What appointment did you have with a letter? Because we haven't sent anything.
It was just a urology appointment, and it was just.
Oh yeah.
He did not even.
Yeah, so I need to. What I need to do now is I need to send an email to the referrer, because obviously you're saying that what he said one thing and he's requested another, and on top of that you don't want contrast. So I need to inform him, and then we need to get him to change it if anything. So I don't know how long that's going to take.
So what we discussed was a CT of the abdomen and pelvis.
Yeah. And without contrast, yeah.
Yeah, I want it done without contrast. Yeah.
Okay, no problem.
Perfect.
I'll let him know. Yeah.
Can you CC me on the email, please?
We won't be able to do that. No, unfortunately, no.
Okay, that's fine.
All right.
Thank you.
All right. Thanks.
Cheers, bye.
Take care. Bye.
Yeah, can you do it?
Is this Jill?
Correct.
Hello.
How you doing? You okay?
Yeah, fine, thank you. I'm just calling regarding your CT scan.
Correct.
Yeah, I believe one of my colleagues called you last week. And you said that you don't want the scan with contrast?
No, I never said that. What
Oh,
was agreed was the scan was for the
yeah,
abdomen and pelvis, which was
yeah,
agreed by the urologist. And
yeah.
for some reason, they've got back to me saying it's for the
Urinary
urinary
tract.
tract, right? So
Yeah.
when we have agreed for CT of the abdomen and pelvis, why have they gone and said urinary tract or whatever it is to find another excuse for not doing the scan, right? Because the
I mean, is
GP
this
agreed, he
regarding the
confirmed.
hematuria?
Things are much worse because it's affected. I've told the urologist, and the urologist at King George agreed it will be for the abdomen and pelvis, right? And he said a booking team will contact me. And
Yeah.
once you have contacted me, you have told me that it's CT urinary tract, which we did not
Yeah.
agree on because my liver is infected, my main organs, the both kidneys, and yeah, that's what needs to be scanned. And overall, if I'm happy for you to do the urinary tract as well, not an issue. But
Yeah.
the main is the abdomen and pelvis.
Um, see, I'm not clinical, so I don't know what it is about, but it's around the same area, pelvis wise.
No, but it's completely different because it does not cover the main organs that are affected, which is in the abdomen pelvis. It will cover my liver, my kidneys, my gallbladder, and because I've been having severe pain and I've been, yeah, they just left me and now they found an excuse on why not to do it. Because I've received a letter saying they've pushed it back to my GP that apparently the patient has said that he doesn't want it done, which is inaccurate. I was told by a team that they will push it on and check with the urologist team that it was for the abdomen and pelvis.
Yeah, the consultant emailed us back saying it's a CT urinary tract for hematuria.
No, it's for the abdomen and pelvis because that's what he told me when I was there at the meeting. And I don't know where the urinary tract
Are
came
you
from.
not getting blood in your urine?
That is correct. That
Yeah,
is
that's why it's a urinary tract scan.
no, but it's my liver affected, which yeah, I've told him both my kidneys, my main organs internally, and he agreed it will be for the abdomen and pelvis. So I don't know why they've gone back and found an excuse on why not to do the scan, and I'm happy for them to do this as well, but they need to cover the abdomen and pelvis,
So
which
did
they
they
agreed on.
say it's you had a cyst or what?
Yes, I've got kidneys on
Yeah,
previous scans.
that's what they're investigating with this urinary tract.
It can't be investigated with the urinary tract because it has to cover the abdomen and pelvis. If they do not cover the abdomen, how and go to the urinary tract, how can I get the kidney cyst, a so-called simple kidney cyst that's there, that has been added? Because
Sorry, I'm not a doctor. I'm
yeah,
just saying what is
basically
on here.
the abdomen and pelvis covers um covers
Are you a
both.
doctor?
No, because I've had these scans done before,
Okay.
and I'm familiar with it. Urinary tract is a whole another area which is just cover one part of the body, but not the main
I
organs
think
which are affected.
you have to speak to your consultant yourself because obviously we can't go back and forth.
I've done
We're
that.
only
I've gone back.
saying
What I've received a letter for them who they find an excuse that apparently the patient has denied the scan, blah blah blah, and we're pushing it back to the GP. This is the same vicious cycle they've kept me in, where they've just been doing everything, finding every possible excuse
because
not to make it happen, because the truth will come out with what's been done to me, and yeah.
I mean that's all we can do. We're just trying to book what they've requested, and he said if you don't want this urinary tract scan, then we need to cancel it because
So
it's what they've requested.
what does the urinary tract cover?
the urinary tract regarding your hematuria, visible hematuria on your urine.
But does it cover the abdomen, the main organs, the liver, the
Like I
kidneys?
said, I'm not clinical. I'm only reading what's on here.
Okay,
And then the radiographers can read it as well, so they know what to scan.
so I'm happy for them to do the urinary tract, but they need to. Can you send them an email back saying they have to?
You're gonna have to speak to your consultant because obviously I don't know what's going on.
I can't speak to them because now I have to. If I have to go back to the GP, then I have to go back to them. Then it's it's creating constant delays when they have agreed to do the abdomen
Well, you've
pelvis. Why
agreed
have they?
to. Well, you've agreed to come for the scan, so I'm gonna email them back saying that you've agreed to have the scan, and I will book you in.
Yeah, we agreed to abdomen pelvis.
So you don't want the urinary tract scan?
They have to stick to their word, which what they told me in the meeting. So can you give them an email that the urologist department at King George agreed for an abdomen and pelvis scan, CT of the abdomen and pelvis in
Yeah,
the
your
meeting.
consultant said that if you don't want the urinary tract scan, to cancel it.
I mean, I'm
Dr.
happy to
Ali
do it.
Mude.
That's not an issue with me, but not they're just coming up with different excuses every time.
You have to speak to your consultant about that. We can't keep going back and forth, and you keep saying that they don't listen. We're only the booking team for the radiology.
Okay, I'm currently traveling out of country. Which available dates do you have after after the 23rd?
After the 23rd.
So I won't be back till the 20th, and then
So what date do you want?
which dates do you have available?
Well, after the 20th or the 23rd?
23rd.
I've got Barking Hospital on the 24th, which is Friday at 3 p.m.
24th, yeah, that'll be great.
Yeah, so appointments at 3 o'clock. You need to arrive at
Oh wait,
2:40.
have you got anything earlier? Because I wouldn't want it too late. So around 10 or early as possible
9 o'clock, Barking Hospital.
on the 24th.
Yes.
Yeah, that'll be great.
Yeah, so you need to arrive at 8:40, 20 minutes before the appointment. Are you diabetic?
No,
No, so you need to fast for 4 hours before the appointment. No food, but you can still drink as normal. Make sure you drink plenty of water.
that's fine.
Okay, I'll email them that I've booked you in, and I'll tell them to discuss the abdomen pelvis issue because obviously, like I said, I'm not clinical and we only book scans.
Yes, please. If you can email them back saying abdomen pelvis CT of the abdomen pelvis was agreed in the meeting. I don't know why they have gone ahead and trying to
Yeah,
push
that
me
was
for
already mentioned in the email, in the initial email to the consultant, and he replied with, if he doesn't want the scan, then cancel.
but that's just an excuse for them not to do it, and especially knowing what I've exposed and what I've been through. But if you can send me the booking confirmation, that would be great.
Yeah, I'll
And
send a text message.
yeah, just let them know that I also need the abdomen and pelvis done ASAP.
Okay, thank you. Bye-bye.
Cheers, bye.